Houston Methodist has developed a robust multidisciplinary anticoagulant safety task force which has assessed vulnerabilities and strategically employed safety enhancements on a broad scale throughout their health system. The Anticoagulant Safety Task Force has implemented standardized best practices to not only close gaps in patient outcomes, but to also enhance the medication use process.
The 2017 ISMP Medication Safety Self-Assessment for Antithrombotic Therapy was used as a starting point for process improvement. This tool was a 115-point self-assessment developed to guide hospitals on antithrombotic-related best practices. Within 4 months, the Anticoagulation Safety Task Force was able to close the identified gaps in our processes, as identified by repeating the self-assessment after implementation of initial changes.
In 2018, Houston Methodist convened an anticoagulant safety task force with the goal of addressing anticoagulation-related issues and providing guidance for therapy selection, management of bleeding, and appropriate use of reversal agents. We are honored to receive the Pinnacle Award for the Anticoagulation Safety Task Force work at Houston Methodist. We are grateful to the APhA Foundation for selecting our program for the 2022 Pinnacle Award. I would like to take this opportunity to thank our executive leadership team for entrusting our pharmacist leaders and investing in our role in quality improvement across all anticoagulation practices. Thank you.
The Anticoagulation Safety Task Force at Houston Methodist began as a small group of individuals led by our medication safety pharmacists, striving to enhance the process of care around anticoagulation. In a short period of time, this small group had expanded into a multidisciplinary group across all 8 of our entities. Through stakeholder engagement, incorporation of best practices, and adoption of continuous quality improvement tools, the committee was a success. What started out as a 2 to 4 month time frame of focused activity has now extended approximately 4 years of contribution and work. The group was elevated because of this great work to a Pharmacy and Therapeutics Committee subcommittee. That gives this group permanence and a direct line for recommendations to our medical executive committees at each of the hospitals. This committee has continually promoted standardization and improvements through measurement of outcomes. And this spans routine activities such as unfractionated heparin, low molecular weight heparin, direct thrombin inhibitors, and novel anticoagulants. In addition to the routine, the very complex care for anticoagulation such as cardiac device anticoagulation and thrombolysis are also a focus of this committee and constantly getting improvements to our care. Most recently, assessment of patients with COVID-19 and their anticoagulation needs were assessed by this committee, bringing best practices and contemporary practices to our organization. Importantly, this group has provided our staff tools and support structures that make doing the right thing the easier path to take, producing reliable, consistent, system-wide improvements. We're thankful to the medical and pharmacy staff and our executive leadership who see this committee as our system's anticoagulation stewardship vehicle. We seek to continue our tradition of sharing our experience at Houston Methodist through the literature and through other means to promote best care for all patients. We thank APhA for this recognition of our team and their work to this date. We have confidence that this team will continue their work to produce innovations that may be applicable to other healthcare entities for the improvement of care of patients across the world.
The Anticoagulation Safety Task Force at Houston Methodist has transformed how we approach anticoagulation management across the hospital enterprise. Our Anticoagulant Safety Task Force really rose to the occasion as we dealt with the foreseveral surges of hospitalizations related to COVID-19, with conflicting and fast emerging literature being published regarding anticoagulation requirements for patients diagnosed with COVID-19, it was imperative that our group focus on reviewing the literature in real time and provide our hospital system with expertise and guidance that was evidence-based. The group convened quickly and effectively with additional hematology and critical care stakeholders to evaluate literature and make recommendations based on hematological societies and public health agencies.
The interdisciplinary collaboration of our Anticoagulant Safety Committee was outstanding when it came to identifying gaps and creating systemic solutions as it related to anticoagulation management. The team accomplished this by doing a process called Failure Modes and Effect Analysis, or FMEA. This process seeks to identify any sort of gaps within our process and also to identify what level of harm they might create, what risk there might be. In those highest risk areas, they work on action plans in order to create systemic solutions to be able to mitigate those risks so they do not reach a patient and cause them harm.